6, a proposed bill that aims to outlaw the distribution of abortion medication by non-medical professionals is passed through the House. News Channel 8's Lauren Henry is live to explain what that means and the debate that surrounds it. Lauren?
Well, TJ, this legislation was introduced last year, but it didn't have what it took to make it to the finish line. This year, it's back, and some argue that it may be another way to reduce women's access to reproductive care.
This bill and bills like these are not going to hurt or harm or scare those who are illegally trafficking drugs. It's going to hurt and harm the women who are using the FDA-approved medication.
Debate filled the House floor during the reading of House Bill 1168, which seeks to slap drug trafficking charges on those found guilty for delivering abortion-inducing drugs or possessing abortion-inducing drugs with the intent to deliver the drugs to another person who intends on using the drugs to cause an unlawful abortion.
This bill is about the trafficking of chemical abortion pills. When we outlawed abortion, what we've seen stop are the surgical abortions, and what we're having are the chemical abortion pills. They're bad medicine.
The author of the bill, Representative Denise Crosswhite-Hader, made claims during the debate on the House floor of the issues and risks to mothers using these allegedly trafficked medication abortions.
What we know is some of these are being brought in, cut with fentanyl, repackaged because it's a profitable way to make them.
We spoke with the representative one-on-one to learn more.
Is there any way that you could kind of provide me with some of these reports that you've seen or a phone number to kind of get a grasp of how often this is really happening?
I know of some individual circumstances myself. Then I've also talked to some pregnancy resource centers. But for me, no matter what the number is, if it's one woman that we can keep from having a mental and physical break, then it's been well worth it.
We were unable to substantiate the claims through the Pregnancy Resource Center Crosswhite-Hader mentioned. As far as fentanyl being present in the medication, Crosswhite-Hader referred to an online article that listed the U.S. Drug Enforcement Administration as its source about the dangers of buying prescription drugs online because of them potentially being laced with fentanyl. But none of the drugs the DEA mentioned included medication abortion. We spoke with Planned Parenthood to hear if they've seen instances like what Crosswhite-Hader describes.
So we generally don't see patients who report on self-managed abortion, but we do know from national reporting numbers about patients who rely on so-called shield states, providers who are providing medication abortion from outside of Oklahoma.
Although the language of House Bill 1168 doesn't address the use of out-of-state medical professionals to obtain medication abortion, Crosswhite-Hader says that it could in the future.
This could address that, though it's not speaking to that specifically right now. This, for what I envision, is still more internal, statewide of where we see those pills.
The bill also states that this does not apply to pharmacists, manufacturers, or distributors who lawfully sell or distribute these drugs, or prohibits the use, sale, prescription, or administration of a preventative contraceptive measure administered in accordance with the manufacturer's instructions. Reporting live in studio, I'm Lauren Henry, News Channel 8.